Running out of breath during a workout, that's normal. But running out of breath sitting on the couch, that's not. And it shouldn't be brushed off as just getting older. The truth is, shortness of breath can signal serious health conditions like COPD, heart disease, asthma, and more. Dr. Ray, can you break down what's actually happening here?
Well, I think when you hear shortness of breath, you have to understand that it's not a diagnosis. It's a symptom. Mm-hmm. So if you have shortness of breath and your color's changing, you know, you probably need to call 911.
Little blue lips there. It might be time for a 911.
Or, you know, little things like you've just had surgery, or you've coming back from a long trip and all of a sudden, acutely you can't breathe. Those are emergencies and things like that.
That could be a clot.
Exactly.
Absolutely.
And then other things that are gradual, you still can look at the different systems that are involved. Like for the lungs, if you have shortness of breath, chest tightness, you know, having wheezing and all that. Mm-hmm. But those are things they still need to get looked at, but are they acute? And then you also have, you know, things with the heart, neurological, and then also some things you'll have shortness of breath, but maybe your oxygen saturation, if you can measure that, is normal with chest tighten. That's more of anxiety.
Well, some of us during the pandemic got used to testing that. So can you tell us a little bit more about that?
Well, there's just a little monitors that you can put on your finger and just tells you how much oxygen is circulating through the body and all that. So there's certain numbers that you want to look at. You want to be greater than 90%. You're really much higher than that,
really
too.
want to be 90%. Yeah. And you want, a lot of people didn't know, and especially during COVID, because I had tons of people that were using them. Make sure your hands are warm.
Yeah.
Do not try and do a pulse oximeter on cold hands because the blood flow is not flowing as well. Yeah. And if you don't have the blood flow, then you can't measure the oxygen. So you get this false low reading. Mm-hmm. And it
doesn't fit with the person that you're seeing.
Yeah. You're like, you're good. Yeah. But you're reading in the 80s. And so I tell everybody, if this is sudden, it's a fire alarm because a pulmonary embolism, a blood clot going into the lung, especially after, like you said, a long trip or a surgery or anything, is an immediate 911.
Right. If you haven't passed out already for it.
If you haven't already passed out,
I've also seen people chalk it off to something that it's not, especially during COVID. I had long COVID. I've had several people during COVID say they had long COVID and they had cancer. And so even if you're just sure of what it is, go get it checked out.
And know what to do. If you've got somebody that has shortness of breath and it's not somebody that's had a lifetime of asthma, or
get them up.
You don't lay them down. Right. Do not lay them down, because at that point you're going to absolutely start to compact the lungs down. And you want to talk to them calm. You want slow breathing. If they have a prescription inhaler, get that emergency there. And don't force in like an Ativan or something to calm them down. Because if it is a physiological, not an anxiety, then you're going to suppress the breathing. And so we have to, kind of guide the families through that.